My name is Yoshi Rothman. I am an assistant professor of pediatrics at UCSD School of Medicine in San Diego. I want to be very clear that there are some specific conditions that have documented low rates of folate in the brain that will respond to leucovorin or folinic acid. And those are very rare conditions, and they tend to manifest with similar symptoms as those with autism spectrum disorder, especially in the first year of life. However, over time, often those conditions will start to develop other manifestations. For example, the folate transport receptor that goes into the brain, when that is malfunctioning, it causes a specific condition. And so for those patients, they may develop things like seizures later on in their childhood. And those can be very specific findings that would lead us to test for something like this condition. So patients who have a documented condition that will respond to folinic acid or leucovorin should be prescribed that treatment. And there's other recommendations for patients and especially for family members of patients so that we can identify other family members and potentially intervene early. However, most individuals with autism spectrum disorder do not have one of these conditions. And so, even though there's small scale studies that suggest that there could be some improvements from leucovorin for kids with autism, often it's been patients who have folate deficiencies, specifically in the brain. And so we want to make sure that before we're recommending something like leucovorin to all patients with autism, that we have more studies that can look further into not just the safety, but also confirming that it's effective and doing what it's purported to do. At this point, we don't have those large scale studies and the long-term follow-up that we need to make these recommendations to most families of children with autism spectrum disorder. So the best approach is to acknowledge the limited information, the limited evidence that we do have, and partner with families and really go through what we know and what we don't know about the medication. As other healthcare providers are aware, without having those large scale studies, we may not identify some more rare side effects or adverse events that could occur in this particular patient population. And so when we're having these conversations with families, we can't say for sure that we're aware of all these rare side effects. Now, leucovorin itself doesn't have a very concerning effect profile for the things that it has been studied for, and it is an active form of a vitamin. So when we think about it, it's unlikely to cause significant harm, but we just don't know for certain, especially in this patient population. So as long as we're having that open conversation with a family, hopefully we can come to an agreement that maybe until the large scale studies are available, that it's maybe not worth pursuing at this time. But I will acknowledge that there are some families that are going to want it regardless. And in those cases, similar to any off-label medication use, we should all just make sure we're on the same page about that. A consent form should be signed really more as an agreement between the family and the clinician to acknowledge the limitations and the evidence that we do have. At this point, knowing that there's been such a rise in leucovorin prescriptions for patients with autism, it's really important that we do consider pursuing a larger scale trial just because we want to make sure that we have the rigorous evidence to make these recommendations, especially to the families who may have already started down the path of trying leucovorin. And at this point, we can either try to identify those patients who have been prescribed leucovorin and see what outcomes have we've observed over time. Or alternatively, if this is something that's really a priority for us in the United States, especially knowing that the rates of autism have risen over time, then maybe we do want to allocate resources to do a randomized controlled trial where we have a large number of patients and really track those patients over time. As I said before, to identify if there are any rare side effects or if there's more common side effects that we just haven't observed. And then similarly, we want to make sure that if we are prescribing this, that it is effective and it's having the benefits that are purported from this from previous small scale studies. So for researchers in this space, I would love to see more of that evidence, and I'm sure families of children with autism would too. And one other thing that I just want to add is families of children with autism are especially those who have severe autism are always searching for anything that's going to help their child. And as a pediatrician, as someone who has young children in the family, I of course want to support those families. And if there's any treatment that's available that can help, I want to know as well. And I know that all clinicians who take care of children feel the same way. So as long as we can remind families that that's how we feel and partner with them, hopefully we can build those therapeutic relationships so that when we do come to having to make these hard decisions or have these difficult conversations, we can be on the same team.